This is FX Radio, and I'm Andrew Whitfield-Cook. And with me on the line today from the US is Stacey Roberts, a former physiotherapist turned herbalist and naturopath. Stacey's been involved in the healthcare industry since 1989 in both conventional and complementary medicine. She's an internationally recognised natural fertility and women's health expert, and she's assisted people in over 32 countries with improving their overall health and well-being by addressing their physical but also their physiological and psychological health with complementary products and services. Stacey's an international speaker and also a best-selling author. Her book, The Fertility Bible, is available at her clinic and on smartphones as well. She's also co-authored over 7 books or e-books and has featured on television, World News, New York, Current Affair, Oprah, filmed by the Discovery Channel and also Sunrise in Sydney, amongst many others. Stacey took over the Sharkies Healing Centre in 2004, a clinic that's worked with couples who have created over 6,000 babies while on her program. And most of them were told it would never happen for them. So, Stacey, I'd like to welcome you to the program from the far-flung US.
Thank you so much, Andrew. I really appreciate you having me.
Now, I think the first thing is to say you've done a lot.
Well, I'm 19 years old. No, I'm kidding. No, I've packed a little bit in a period of time, yep, but when you enjoy stuff, you kind of go with it, don't you?
Yeah, that's right. So you did your physiotherapy training in the US, is that right?
That's correct.
Yeah, whereabouts? Tell me about it.
I was at Marquette University. I started out in pre-med and then found that as a doctor I wouldn't be spending as much time as I would be with the patient. So what I found from an injury, sports injury myself, I found that I wanted to create a relationship with the patient that I was seeing. So that's what attracted me to physiotherapy after a sports medicine or sports injury. I've got exposed to sports medicine. And then when I moved to Australia, I wasn't able to practice as a physio, and I was already studying alternative medicine, herbs, and supplements, and all those wonderful things. And I just decided to take it to the next level and get certified.
Now, this really interests me because I come from the sort of medical training myself, and I was not definitely not a supporter of, natural health care.
Me either. I agree 100%.
Great. So what changed?
Well, I mean, I'll go back, in the 1990s when I was a physiotherapist.
Yeah.
Basically, I remember one of my friends taking St. John's wort, and I just was aghast and said, oh, my God, that stuff can kill you. You know? So that was my mindset from the training that I had. But when I had my own health issues after I had my son, I found that there was nothing medically or conventionally that was helping me, and everything was turning up normal. And I knew I didn't feel very normal. I was exhausted. I had bowel issues. I had skin issues, but, nothing conventionally could help me. So that's when my interest turned to natural therapies. And then my interest became more of a pursuit because it did significantly help me, and I saw massive changes.
So this is the interesting thing, and this happened with me. What was the point at which you thought, oh, blow it, I'm going to try this stuff that I don't believe in? What was the changing mental aspect?
I will never forget it, actually, Andrew. One day someone came by. It was just somebody going door to door in regards to selling these supplements. And I thought, oh, this is crazy. This crazy person dropping off these supplements, but it was a pack of information. They left it at my door. I left it there, probably sat there for 2 or 3 weeks. In the meantime, I'm feeling worse and worse and worse. And I just thought, it's not going to hurt me, and nothing else is out there that's helping me. So I'll just try this. And I tried it, and, my bowel issues went away. My skin started to clear. And I said, this is crazy. I didn't think there was any research that supported this, but when I started digging through the research myself, I found there was research to support it. It just wasn't, in abundant amounts or published in the, medical journals that we would normally have used as reference.
I think you've touched on 2 key points with natural medicine. The first one is, it won't kill you often. And, with a caveat there that there are certain interactions that you've got to be aware of, and it's got to be done responsibly by a healthcare provider suitably trained in natural healthcare. Granted that. Mm-hmm. But natural healthcare is very forgiving. Mm-hmm. And the other one that you touched on is that there is research out there if you will only look. I remember I would not look. I just judged it. So thanks for that. Tell me what happened with the interest in fertility care. What started you on the road with this naturopathic specialty?
Well, I had my own issues with secondary fertility. So during that time that I wasn't feeling well, I was also trying to have my second child, and that wasn't happening. And that was another catalyst for me to look at alternatives as well. And in the meantime, after I was certified and practicing a little bit, I met Ruth Sharkey, and over a 6-month period of time, she handed her business over to me. And at that time, honestly, Andrew, I had no idea that she was a fertility specialist because I just never came across her, which today I still think is quite odd. But when I took over a clinic, and she was educating me about her ways of doing things, her techniques, I found out that it was majority for fertility. And then unfortunately my marriage didn't last our fertility issues. Otherwise I'm sure that that would have significantly helped us. But what I found was the ability to be able to help others and be empathetic towards others because I had been through what they had gone through was invaluable. So I kind of look at it as I was meant to experience something like that so I could be much more effective at what I was doing, what I'm doing in regards to fertility.
So, Stacey, today we're going to be discussing a subspeciality of the fertility care, and that is a potentially devastating condition called pre-eclampsia. Can you tell me, though, what exactly is this?
Well, pre-eclampsia basically today is being diagnosed with anyone with high blood pressure in pregnancy past the 20-week mark, and then also confirming that there's protein in the urine when they take the urine sample. So basically it's a very dangerous situation that a pregnant woman can get into later in a pregnancy that can lead to eclampsia, which can lead to seizures and kidney failure and liver failure and all those types of things. So it's a very serious condition, and it's something that many are paying much more attention to prevent the pregnant woman from getting into serious trouble during her pregnancy.
And how do you differentiate that from eclampsia?
Well, eclampsia basically is when the blood pressure has been so high for so long that there's going to be some, again, seizures and really serious ramifications in regards to the liver and kidney. So you want to catch it early so it doesn't get to the point where the woman is experiencing seizures and where her kidneys and liver are shutting down. So that would be someone who's not monitored well through the pregnancy, and that's why we always encourage, along with seeing a naturopath, that they're seeing their OB and GP and getting monitored. And we'll look at blood pressure as well through to make sure that it's not getting up there to where it shouldn't be.
So what are the signs?
And they're doing the urine test too to see if they would be progressing towards the preeclampsia.
Yeah. What are the signs and symptoms, though, that you will see in a pregnant woman with pre-eclampsia? What should pregnant women be looking for? And certainly, what should practitioners be doing?
Practitioners definitely should be always monitoring blood pressure for the patient and always encouraging them to have their blood pressure monitored either at home or in the doctor's office as well, depending on how often they're seeing their physician. With the signs that someone who's pregnant can look at is it's 20 weeks or around there, or even before there, if their feet and hands and face are swollen. I don't know if you've ever seen someone with high blood pressure during pregnancy, but their face is distinctive, round and puffy, whereas the rest of their body obviously looks pregnant, but it doesn't kind of look out of place. Their hands can get very, very puffy and swollen, as well as their feet. So that's why we would always ask, how are those things going, and if you're seeing any changes, to see the doctor as soon as possible. And also feeling unwell. When you have high blood pressure, you might be getting headaches, which is not unusual for somebody who's pregnant, right? So that's the reason why it's really important to be seeing your healthcare professionals to monitor these things such as blood pressure and urine output, to make sure that there's no signs of it developing.
I remember we used to always look out for things like blurred vision and the tight wedding ring. Was there?
Right, exactly. Right, that's true.
Not always available these days with the changing relationships that we see in our modern society.
That's right, exactly.
And a significant portion of women suffer from pre-eclampsia. Tell me about the risk factors and why this condition is becoming more prevalent.
Well, if you look at just high blood pressure in general, Andrew, that's going up and is a condition that's worsening all over the world. If you look at stats from the U.S., I believe the number of deaths due to just hypertension, this is not related to pregnancy, but just high blood pressure has increased nearly 62% from the year 2000 up until 2013. So the fact that we're experiencing high blood pressure even outside of pregnancy, the risk factors would be similar to those that are in pregnancy, such as obesity. And obviously, women are going to be gaining weight during pregnancy. Some women will think they can eat whatever they want when they're pregnant, or will not pay as close attention to what they're eating, and also because they're feeling sometimes very horrible in the beginning. They're looking for carbs and sugary foods to kind of help regulate their blood pressure, their blood sugar. And those things can eventually lead to, insulin sensitivity, and then insulin resistance, and then you are at more risk for the gestational diabetes, which is also increasing for women. So a lot of it is related to dietary issues. The other thing is thyroid and adrenal issues. So what they find in some of the tests, when they look at women who are normotensive during their pregnancy, where their high blood pressure is fine throughout the pregnancy, they notice that there's an absence of placental cortisol. So there's no cortisol really present when they look at the placenta. But women who have the pre-eclampsia, what happens is that the cortisol is significantly elevated. So there's some type of stress on the system causing the adrenals to be producing significant amounts of cortisol. So stress, both from what we're eating, because our diets, unfortunately, are not where they should be. And again, in pregnancy, there can be a higher risk of that because of the cravings and not feeling well during pregnancy. Nutritional deficiencies also can be an issue that are exacerbated as well through pregnancy because of the different things that the women are tending to eat or not eat when they're pregnant. So there's many different areas that are adding to the increased incidence.
Seems to me like it's a condition of the 21st century with our high sugar, carb diet and high stress.
Right. And you know what? I think that the medical system is also doing a better job of monitoring and checking for it as well, too, so that they can catch it early enough and that it can be reversed so that it doesn't become eclampsia and become a large problem. So I think that's also a part of it, too.
Okay, so let's talk about treatment of pre-eclampsia, both the medical and the natural therapies that go along with it. What do you include? What do you do?
For myself, I can't really speak to the medical aspect of it, obviously not being a physician, but, I know that they would give a blood pressure medication. They would sometimes they would look at the person's diet. They'd obviously be screening for gestational diabetes and doing all those things. From a naturopathic point of view, what we want to do is prevention from the get-go. So seeing somebody when they're pregnant and talking to them about their eating plan, getting the sugar out, giving them other things to take if they're nauseous in that first trimester instead of going to those carbs and food. So that could include things like ginger. In the first trimester, there's, controversy of what you should give in regards to herbals and things in the first trimester. So I tend to stay away from a lot of herbs unless they were my patient and I know how they react to herbs. If I've not seen them before and they just come to me for pregnancy, I'm a lot more cautious because I don't know how they're going to react to certain herbs. So in that case, again, I really focus on their eating plan and supplementation. So there's some really effective supplements that will help with preventing and getting to the point where they're experiencing the pre-eclampsia.
And what about things like stress management and the psychosocial aspects? What do you do there?
Absolutely. We talk about, in our fertility program, we're already addressing those things. So if they're women who have been through our fertility program, they're doing our 5-step fertility solution, which includes the 5th step is stress management to manage their stressors. Now, remember that stress is also stress that we're putting on our body through what we're eating. So that's our number one step is your eating plan. So again, even though you're pregnant, you want to make sure that your eating plan is optimal with balancing your proteins, your good carbs, and your good fats, because those are all very important in regards to managing your blood sugar levels, decreasing inflammation, and decreasing your cortisol response, or I should say really balancing your cortisol response. Yeah. So we want to do a good job of educating the patient what they can do in regards to managing the physiological stress that just comes from what they're eating and what they're exposing themselves to, but also the emotional stress of what they're dealing with. Maybe it's a first pregnancy. Maybe they're trying to renovate their house while they're going through this. Maybe their relationship isn't great. So we also do, things in regards to stress management. So, recommend pregnancy yoga, meditation, visualization, just, being. So many people are so busy these days, they don't even have a chance to kind of be. And women are working all the way through pregnancy many times. So, that it becomes very taxing on their system as well, too. So helping them learn how to manage that stress is very, very important.
Women are often the human doings, not the human beings, aren't they?
I like that.
What sort of supplements do you use when applicable?
It depends on the case. Everybody's going to be individual, looking overall at their situation, but pretty much what everyone can do, and these have been shown to be beneficial in regards to helping to, I don't want to say regulate blood pressure, but keeping blood pressure in the normal area, would be probiotics. Probiotics have had some significant studies over the last 5 to 10 years, and now it's just from here to the next 10 or 20 years, the research on probiotics is going to be booming. They're finding specific strains that are addressing specific disease states, and it's just amazing the things that are going on in regards to probiotics. But any good multi-strain probiotic that a patient can get on through pregnancy is going to help with her gut health, her immune system, and just going to help overall manage inflammation and get more nutrients into our system. So if we're dealing with nutrient deficiencies, we obviously want to get more of those nutrients in through the gut into the system. So probiotics are excellent in regards to that. Fish oil is another thing that women can take to help with decreasing inflammation. It's been shown in a few studies to be effective to prevent pre-eclampsia. There's a few studies that show if you start fish oil later on, though, after the blood pressure is elevated, that it's not as effective. So again, prevention is really the key. Starting them on fish oil if they're not already on it prior to pregnancy. Great for her, for the baby's development. There's so many beneficial outcomes that you can get from taking a good quality fish oil supplement that has been tested and has been gone through the process where they remove as much of the heavy metals as possible in the fish oil. Yeah. The other supplements that I always look at is the calcium and magnesium, because those are really important for relaxing the arteries and being able to help control and help regulate blood pressure as well too. But if someone is insulin resistant, you can give them all the magnesium you want. If insulin isn't getting into the cell, the chances of magnesium getting into the cell is really minimal, because insulin helps magnesium get in the cell. So we're just going to be, it's just going to be exiting our body if we're not regulating that those blood sugar levels to minimize insulin resistance and to make the body more insulin sensitive.
So tell me what you use then to help magnesium to be more effective. So you concentrate on the diet first?
Right. The diet needs to be good first. We need to see that the blood sugar levels are normalizing, that insulin levels are good, so that we can be confident that magnesium is actually going to be getting absorbed into the system. And then we also look at, the form of magnesium that we're using. I'm partial to the powders versus the tablets because they're going to tend to be absorbed better. However, good magnesium citrate should be absorbable in either form, but I am partial to the powders. And what you find is, like we said, that before that the natural medicine can be more forgiving. We know that when we're taking too much magnesium, because we start to get loose bowels and diarrhea, so there definitely are signs of when to back off and decrease the dose. Yeah. And then we're monitoring throughout to see if it's effective or not.
I remember years ago some research looking at either calcium or magnesium, and the research on magnesium was done by Guy Abrahams. All of them were sort of smaller trials, whereas the research, the medical sort of line was leaning towards calcium, and the research there was done by a lady, I can't remember her first name, but it was Thiz Jacobs. And so, there's this sort of juxtaposed opinion as to calcium or magnesium. Tell me how you use these two, because there's this old naturopathic axiom about the 2-to-1 calcium-magnesium ratio, which I'm sorry I don't adhere to. But what's your thoughts?
Well, Andrew, there's what we learn in school, and which we always have to get that baseline to understand. What we learn from the books, and then what we look at through clinical practice. And I guess what I do, again, is really look at the patient. I look and see overall what they're eating, I look and see overall what supplements are they already on. I really want them on a good, pregnancy multivitamin while they're going through pregnancy. And I'll have them on a good high-potency antioxidant multivitamin before pregnancy and usually continue that right through, along with the fish oil and the probiotic. So I'll look at the 2-to-1 ratio, but then, assess whether that is appropriate for that particular patient. So I don't really go by a standard formula to give to everybody because everybody's so individualized. So, like I said, if I do the 2-to-1 of calcium, magnesium, but somebody's insulin resistant, it's just not going to be effective. So I want to, again, look at the whole person, the big picture in order to decide, what ratio or which mineral I'm going to give more of off of the base that I'm already having them on. So I'm not a person that will give them, a zinc or magnesium or calcium in these, single doses. I'm a big believer in synergy. These vitamins in the plant, they work in synergy. So we want them to work in synergy in our supplementation as well. So we have a base formulation that we give in regards to the antioxidant and multimineral, and then we look at over and above that what they may need in regards to calcium, magnesium, or any other. Zinc is also a great mineral to use as well, too, for relaxing blood vessels as well. So there's a lot of different things that we can do. And we can look at blood tests, and we can look at ways of testing whether they're low in certain nutrients. And certainly vitamin D is now getting a huge amount of support for its use, making sure that we're not deficient in vitamin D because that seems to be impacting every cell in our body when we are. So, there's research coming out about, vitamin D levels and blood sugar regulation and blood pressure regulation and the cardioprotective effects of it. So, there's so many different things that we can look at when we assess those through blood tests or urine tests as well. Even some people are using the hair mineral analysis to see if there are, some deficiencies as well. I don't like to use one of those by itself. I like to get a couple different tests to see if we see the same things in each of them.
Yeah. I think that's a great thing about tests in general. Don't look at the test for the answer. Use it to validate your decision.
Exactly.
Yeah. Epigenetics is a hugely exploding area of interest in all conditions, but especially relevant to pre-eclampsia and fertility with the methylation issues. Talk to me about that. Tell me what you see and how you treat stuff.
Well, there's a lot of different things that you look at. Again, it depends on whether you're seeing the patient prior to becoming pregnant or just when they are pregnant. You want to make sure that their methylation system is working as well as possible. And some people don't have, the MTHFR gene genetic defect, either homozygous or heterozygous, and that will make them that will give them less ability to absorb regular folic acid. So we want to make sure that they're utilizing a folic acid and B vitamins that are supportive for their system. Again, that's going to be part of the base program that they would be on anyway. But if they have one of those issues, either heterozygous or homozygous in regards to MTHFR, for example, then we're going to be looking at doing methylated folate or some folinic acid, which is much more available in Australia than the methylated folate. Yep. So I would be looking at utilizing that as well. Again, looking at the whole picture to see if that particular person needs it. And another way to look at that is through blood testing of homocysteine. So the research is showing that if homocysteine levels are normal, and I don't mean normal by blood test, because normal by blood test is 0 to 15, and once you get over 9, it doubles your risk of heart attack and stroke. And I don't know, but I don't consider that normal. So no. I'd like to have people under the level of 7 or 8 for homocysteine, and that at least gives me more confidence that the folic acid that they're getting through their foods and their system, that their body's actually utilizing that. So homocysteine levels are starting to creep up, and I'll switch to something that I know is going to be much more absorbable, which would be in Australia, which would be the folinic acid.
Yeah. What interests me is, like years ago when I sort of started down the road of natural medicine, and I guess a few years into that it became standard therapy to use folic acid with all pregnant women. And it was folic acid. And on a population basis, that prevents neural tube defects. But what we're seeing now is these epigenetic SNPs affect a certain population or a certain subgroup of the population, which we might not have been able to tease out the results. So I guess my question is, how have you found your practice changing now that we're looking at these subpopulations and epigenetics? Do you look for them, or do you wait to see if there's a symptom that pops up that says, oh, I'm going to look at you in a different way? Or how do you identify these potential SNPs? There's
two aspects to that, Andrew, at least in my opinion. One is the cost to the patient. So I certainly could recommend, 100 tests for them to do prior to coming to me or when I first see them, to look at if there's gene mutations and to do some urine analysis. There's HealthScope, which has some great testing as well. But what I try to do is I try to keep costs down for the patient and look for the red flags. So do they have issues with implantation? And this is for fertility now.
Yep.
So did they have issues with implantation? So did they have recurrent miscarriages? Did they have any clotting issues that they know of? Is there any clotting issues or heart issues in their family? The things that in their family history that we assess to see if they might be, epigenetically, if you will, on the road, dealing with the same types of things that were overlooked in their parents or their grandparents or that kind of have morphed over the years into, present day people running around the earth. So I'll look at all of that before I would recommend specific tests. And then if I'm knocking my head against the wall and going, okay, this isn't working, they're not getting pregnant, then I'll go into going, well, these tests haven't been done, let's look at those as well.
Yep.
And some patients will say, look, I want all the tests done right away, I don't care what it costs. And, then we would go through the more common gene mutations, if you will, that could be impacting or that we've got good research on to show that, these particular nutrients will help them. But I don't do it for everybody across the board from the standpoint of if I did, probably 50 to 60% of them wouldn't have needed to spend that money in the first place, and possibly even a bit larger percentage depending on where we're talking about, what country we're talking about.
Yeah, and I think it would definitely impact on their stress management.
Oh, absolutely, absolutely. And then the other aspect is, companies like yours have such great, BioSuper's have such great education that over the years, I've learned so much from the speakers that you guys have had. So that also helps me zero in on identifying the particular patients that tend to be more at risk. And then, suggest those tests to those patients based on their history and what they're presenting in front of me. But certainly if somebody is dealing with or has polycystic ovaries, for instance, that's another risk factor for pre-eclampsia. So I would definitely, if they haven't been already tested in regards to their homocysteine or their THFR, I would tend to look at that more in somebody like that. Mm-hmm. Or if they've had a previous pregnancy where they've had gestational diabetes or pre-eclampsia, those are the things that I'd be looking at to see what would be the obvious necessary tests to look at, see whether they need to spend the extra money on the folic acid versus just having the normal folic acid. And another issue that's also really not talked about at all, Andrew, is the male side of the thing as well, too, in regards to the neural tube defects and the folic acid. They're finding now that, men who have low levels of folic acid can have issues with their sperm, but also that can also lead to issues with neural tube defects in the baby as well. And that, nobody's ever talked about that. That's only in the last 2 or 3 years. I've been harping on it for a decade, but finally in the research we're starting to see that, the guys are important. Their sperm does make a difference.
Yeah, 3 months beforehand.
In the health of that pregnancy. Yeah, exactly. Yeah. So there's a whole lot of stuff going on about the epigenetics, and also epigenetics from the standpoint of the emotional as well, and the emotional stress. So we look at it as, above the gene, and how our thought processes and how we're dealing with stress are impacting our genes as well as how they switch on and off. And that goes all the way down to the cortisol levels and whether there's too much cortisol or too little cortisol based on how our body is managing and handling stress.
I did want to go back a little bit. You spoke a little bit about vitamin D, and vitamin D, as we know, because of its extreme safety, they're now restricting the testing for vitamin D because we're wasting millions of dollars rather than just using safe and appropriate dosages. And I remember Jenny Gunton at Westmead Hospital used 5,000 IU in, I think, pre-diabetic or just ladies with gestational diabetes, whereas Bruce Hollis used 4,000 IU, but our standard Australian things are 1,000 to 2,000 IU. Tell me what dose you use.
Mm-hmm.
How do you dose that?
This has changed actually just recently. So there was a recent study, and I'll hopefully remember that before we finish this discussion, but a recent study in regards to vitamin D and the actual proper dosage of vitamin D for people. And it turns out that when they look at people on average, they're getting about 2,000 IUs from the foods that they're eating. They're not getting much from the sun because we're lathering up in sunscreen. Slip, slap, slop, is that what it's called in Australia, right?
And working indoors at lunch.
We're lathering up in sunscreen and working indoors, and we're not getting out very often, especially in the mid-afternoon when, the vitamin D creation in our system would be the highest if we were exposed. So they looked at that and said about 2,000 IUs are coming from food, and they look at the optimal dose would be about 6,000 IUs throughout for each day. So anywhere between 4,000 and 5,000 IUs. I have recommended 4,000 for the last few years, and will continue to do so based on this recent recommendation. Mm-hmm. But again, that might be too low for somebody who is deficient. So that's where we've got to look at their vitamin D levels while they're pregnant. I do that before they become pregnant for fertility, and then ask their doctors to monitor that occasionally during pregnancy to make sure. Because again, we're not having, hopefully, these women who are pregnant sunbaking throughout their pregnancy. So they're not going to be out in the sun probably either because they're feeling uncomfortable in the heat and yada yada for some of them. Mm-hmm. So we want to test that to make sure that they're getting enough through to prevent pre-eclampsia and eclampsia from occurring in the pregnancy. But that would be where I would start. That's the dose that I'm having my people on through pregnancy, and then if there's evidence of a deficiency, however, it might be a larger dose than that to get them up to where we want them to be, which is about between 80 and 100.
Yeah, the doses that were the serum levels, if we were going to measure them, they've got to be a lot higher than the 50 nanomoles per litre that was previously recommended. Yeah,
absolutely.
So how long do you find it typically takes if somebody is adherent to the guidelines that you propose? How long does it usually take to get pre-eclampsia under control?
We do start seeing an improvement. Again, if they're following to the letter, if they're working on their eating plan, if they're able to exercise to a degree to keep their blood sugar levels regulated, if their thyroid function is optimal and their physician is treating the thyroid if necessary, if all of the ducks are in a row, we will see an improvement in the blood pressure levels within 1 to 2 weeks, 3 weeks at the most. And if we're not seeing that, that's when, if the patient has decided they didn't want to do the blood pressure medication, if the doctor had recommended that, that's where I start saying, look, you need to really talk to your physician about whether you need to go on that for safety's sake, because if it's still climbing and we're doing everything possible, then that's where I think naturopathic and conventional medicine can work very well together, is we utilize them together to help the patient. I think it makes a huge difference. So it needs to be closely monitored once it's discovered and they're on the holistic program, if you will, by both the doctor and the naturopath to make sure that the improvements are happening within that 1 to 3 week mark. So we don't want anything to get to a point where it's, unable to be controlled without very large doses of medications.
You've mentioned thyroid, and this is, I think it's probably another whole podcast, but can you give us some brief tips about what you do there to normalise thyroid function or to support thyroid function?
Sure. Well, we have a bit of an advantage because over the last decade, what I've been doing with my patients is looking at their thyroid levels, not just their TSH levels, but their free T4 and free T3 levels. And I started doing this because a patient of mine came in to see me, and she was told from the same doctor, one test she had done, she said, your thyroid medication is a little bit high. We don't need to do anything about it. It was a little bit high. We need to adjust it. But the patient said, and she was basing this on the serum levels that she saw for TSH and T4. Yeah. And the patient said, look, I feel really good. Can I come back in like 6 weeks and get this get the test redone and then see where it's at? And the doctor said, yep, that's fine. It's not in any crazy range or anything like that. So they came back, and the results was TSH was actually higher than what it was before. And the doctor looked at the test and said, no, you're fine, you're good. And the patient said, wait a minute, when it was high 6 weeks ago, then you said I needed to be adjusted, but now it's even higher. What's going on? And when she came and brought the blood test into me, it was at 2 different pathology labs, and the normal level was different from one pathology lab to the other.
Yeah.
So in one pathology lab, she was being diagnosed as hypothyroid. In another pathology lab, she was being diagnosed as normal. So it was crazy. So I started taking blood sample, or not taking blood sample, recommending that patients get their thyroid tested, both TSH, free T4, and free T3, and sometimes reverse T3 every few months that they're seeing me. And then right before, when they tell me that they're pregnant, I have them get that blood test done again, and then I compare that to the previous one. So we have what we call our optimal levels for thyroid function, and 90% of the time they're within normal limits. So they're just a much smaller range and a much more consistent range than what we see in different pathology labs. So it's based on our population of fertility. So that's what I then based it on through pregnancy, and also obviously how they're feeling through pregnancy, and weight gain and all that type of stuff that's going on, and how the baby's progressing. So this isn't really quick, Andrew, but I'm doing the best I can. So if the thyroid, in particular T4 levels, look like they're low or lowering through pregnancy, or lower than what they were when we looked at our baseline, then we'll look at things like iodine support and supplementation. We'll look at zinc and selenium and chromium. Again, it really depends on how they're presenting. But also, we've got to consider the adrenals. So if their cortisol levels are up or even too low, and their adrenal function is out of whack through pregnancy for whatever reason, it's just the physiological stress from their eating or whatever's happening in regards to their body, or the emotional stress, that will also pull down thyroid function. So we've got to look at those two together, and we've got to maximize those as well. So it is a whole other podcast, Andrew. There's specific things that I look at in regards to nutrients and herbs as well too. Some great adaptogens that can be used later in pregnancy to help with both the adrenals and the thyroid. There's just so much that goes into that. And when I do my fertility mentoring program through you guys with biophysical support, I'll be teaching the naturopaths and natural therapists specifically what to do with thyroid and adrenal function for both fertility as well as through pregnancy.
Well, there you go. I think we need to explore another podcast right here and now.
Yeah, sounds good. Sounds very good.
So just briefly, Stacey, what cautions and caveats can you give the listeners? For instance, when do you think it's not relevant to treat somebody with pre-eclampsia and to refer on?
Always refer on if, number one, you're not familiar with it. Someone comes into your clinic, you don't do a lot with pregnancy, and you're not sure what the heck to do or which herbs to use, then absolutely refer on. Number two is if it is significantly high, very far advanced, I would rather see the patient being on a low level of blood pressure medication to normalize that blood pressure, and then and along with that, working with their diet and their eating plan and their supplementation program to support them able to come off of that under their doctor's care and their doctor's supervision if wanted, leading up to delivery or after, depending on what the OB decides is the most appropriate steps. So based on my experience, because I've been doing this for over a decade, I don't know that there's ever going to be a situation where I'm not going to give them some naturopathic suggestion, whether it's just simply what they're eating. We look at nutritional supplements or herbs. I'm going to look at some aspect of that for them. However, I'm not going to solely rely on that if it looks as though the blood pressure is way out of control or not regulating, or they have a significant history of that. I'm always going to be wanting to work in conjunction with the physician to monitor that with me so that we're all on the same page. Does that make sense?
Yeah, sure does. Stacey, I've got to thank you for taking us through, and I get we really do need to explore another podcast with some more of this thing. So we'll welcome you back at another time.
Thanks, Andrew.
But I really thank you for taking us through, the minerals that you use, some probiotics, which I totally agree is an exploding area of research and so exciting. But very importantly, the emotional aspects that we need to concentrate on, the dietary aspects.
Absolutely.
Because it's such a 21st century disease or condition.
Absolutely. I totally agree.
So, Stacey Roberts, thank you so much for joining us today. This is FX Radio, and I'm Andrew Whitfield-Cook.